Hello everyone, my name is Haley and today I'm going to be talking about vaping and its health risk. Vaping has become very popular among teenagers and young adults. Many believe that it's better for you than cigarettes, while research shows that it still has very serious health concerns involved. E-cigarettes, also known as vapes, are battery-powered devices that heat liquid into an aerosol that users inhale. This liquid usually contains nicotine flavorings and other chemicals. While they don't contain tobacco like traditional cigarettes, they are still harmful. According to the Center for Disease and Control and Prevention, most e-cigarettes contain nicotine, which is highly addictive and can harm brain development in adolescents and young adults. The brain continues developing until you're about 25, and nicotine exposure during this time can impact your attention, learning, mood, and impulse control. The U.S. Food and Drug Administration also warns that vaping products may contain harmful substances such as heavy metals and cancer-causing chemicals. Even though these products are marketed as safer than cigarettes, inhaling heated chemicals into the lungs can cause inflammation and damage. One major health concern linked to vaping is a condition known as EVALI, which stands for e-cigarette or vaping product use associated lung injury. In 2019, the Centers for Disease and Control Prevention reported thousands of hospitalizations connected to severe lung injuries from vaping. Symptoms include shortness of breath, chest pain, and even respiratory failure. Another major issue is addiction. Nicotine is one of the most addictive substances available. Many vaping devices deliver high concentrations of nicotine, sometimes even more than a traditional cigarette. This makes it easy for users, especially teens, to become dependent quickly. The National Institution on Drug Abuse states that nicotine addiction can increase the likelihood of future substance use and long-term dependence. From a critical health perspective, vaping also raises concerns about marketing and youth targeting. Flavored products like fruit, candy, and mint make vaping especially appealing to younger populations. While regulations also have increased in recent years, accessibility and social media influence continue to drive use among adolescents. In my opinion, one of the biggest misconceptions that vaping is just water vapor. In reality, it's an aerosol filled with chemicals that enter directly into the lungs and bloodstream. While vaping may sometimes be promoted as a smoking tool to help you stop smoking, for adults, under medical supervision, recreational use, especially among teens, carries significant risk. Understanding that vaping is not harmless is the first step. Schools and communities should continue prevention programs, and individuals should be aware of how quickly addiction can develop. If someone is already vaping and wants to quit, resources like counseling, nicotine replacement therapy, and support programs can help. Vaping is often marketed as a safer alternative to smoking, but it still poses a serious health risk, especially for young people, from nicotine addiction and brain development concerns to lung injury and chemical exposure. The evidence shows that vaping is not risk-free. Making informed decisions about our health is critical, and understanding the facts allow us to protect ourselves and others. Thank you for watching.